Welcome to Speak Up and Stay Alive Radio with author, speaker, and your host, Pat Rouleau.
Serving you a generous helping of everything you need to know to help you and your loved ones stay safe during any doctor or hospital visit.
The program is not intended to replace medical advice from a licensed professional, but rather to encourage you to become a well-informed participant in your health and well-being. And now, your host, Pat Rouleau.
Hello, I'm Pat Rouleau. Welcome back to our time together, where we come up with all kinds of ways to speak up and stay alive. And I'm happy you joined me. Well, before we begin with the goodies I have in store for you today, let me remind you that today is the last 7 o'clock a.m. program on WHK in Cleveland. It's simply too early of a time for most people to get up and listen, and I know that we do have many loyal Speak Up and Stay Alivers who listen to both shows, one at 7 and again at 9 on WHKW. That's 1220 on the AM dial. But we're adding other stations, one in Pittsburgh and 218 cable television stations to our lineup. But not to worry, we'll still be on every Saturday morning at 9 o'clock on WHKW AM 1220, The Word. We are, however, tightening up that program as well, and starting next week, the first week in February, the show will air for 30 minutes rather than 50 minutes. We're playing with some format changes to include more on-air feedback and comments from you and shorter guest segments, but I'll share that later in today's program. Now, you'll still be able to hear the hour-long show on our website, speakupandstayalive.com, and in fact, we archive all of our past shows so you can spend days at a time just listening to the show. Well, for now, let's get started because later in the program I have a very cool guest who founded a healthcare center that treats those with chemical sensitivities, and that includes substances such as air pollens, molds, animal danders in the air, machinery, carpets, cleaning supplies, perfumes, chemical byproducts, diesel fumes, and yes, electromagnetic fields. So sit back, relax in your favorite seat, turn off that cell phone, and you'll soon find out why. Because right now, it's time for the healthcare hazard of the week. The wireless takedown. Did you know that many common ailments may be traced to substances you are exposed to in your everyday environment? Symptoms such as headaches, sinusitis, fatigue, joint aches, asthma, and chronic infections may be caused by environmental factors. And today I want to talk about perhaps the biggest and most dangerous one, because we are in the midst of a wireless takedown when it comes to our health. And I'm talking about EMF. No, does not stand for every mother's friend, but rather electromagnetic fields. EMF is a physical field produced by electrically charged objects, and it affects the behavior of an object present in the field. Now, this field extends outward to a distance related to the strength of the current. There exists both an electric field and a magnetic field. The electric field is produced by the stationary charges, and the magnetic field is produced by current that's in motion. Now, we all learned in school that the Earth has a magnetic field. Power lines have magnetic fields. Any appliance which uses a motor and electricity can have both an electric and a magnetic field. The distance these fields extend from the source depends on the strength of the current and the voltage. So, for example, several high voltage power lines with electricity totaling 765,000 volts can have a magnetic field extending 2,500 feet from the lines. Now, we all enjoy the benefits of electricity. It allows us to cook, it lights our way, and allows us to use many appliances which make life easier and more enjoyable. It's used in medicine to diagnose and treat injuries and other medical conditions. The heart rhythm depends upon electrical stimulus. To prove this, think of electrical cardioversion. Now, we've all seen this on TV and hopefully haven't had to experience it, when someone's heart stops beating and the responders use the metal paddles or the patches applied to the chest wall. You know, think Grey's Anatomy. Well, That is a procedure in which an electric current is used to reset the heart's rhythm back to its regular pattern. The low voltage current enters the body through metal paddles. So it's very clear that we are electric beings. Our cells constantly transmit and receive energy, and each type of cell has a frequency range in which it operates. So for anyone to say that our bodies are not affected by electrical fields, it's pure lunacy. Why then does electricity restore a stopped heart? Well, now this example makes it clear that man-made electrical fields affect our body. Their effect depends on the strength of the fields, the distance from the source, and the length of the exposure time. However, there's plenty of debate regarding safe levels. And different standards, and I hate to admit, much higher standards exist in the United States than anywhere else in the world. RF, which stands for radio frequency, and microwave radiation, can create hazardous biological effects due to energy absorption by the body. Yet the United States uses outdated measurement and safety standards. Cell phones produce electromagnetic fields in the ultra-high frequency range, or the radio frequency range, again called RF. The radiation emanating from these RF fields can be linked with increased risk of glioma, brain cancer, and acoustic neuroma, a slow-growing tumor close to the ear, among other health hazards, such as infertility. Therefore, prudent choices must be made regarding the use of cell phones. Extended use, or actually any use of cell phones held against the ear, is not recommended. If you must use the cell phone, it should be placed on a table or a surface away from the body. And they say when carried on the body, it should never be carried in the chest area or the ground, but I say never carry it on your body. Children who have susceptible nervous systems and brains should be restricted in their use of cell phones, as in no cell phones for kids. The power of electromagnetic energy, whether high or low frequency, must be recognized and respected. Its effect on human life and the functioning of the entire body must be understood. We should take advantage of the positive uses that it affords us, but we must recognize the problems it can pose, especially those with chemical and heavy metal toxicity, suppressed immune system, variations in heart rhythm, the young, the old, and the allergic. And our guest today, Dr. William Ray, founder of the Environmental Health Center in Dallas, in a double-blind study showed that certain individuals can be extremely sensitive to EMF. The participants in the study experienced symptoms involving the nervous system, cardiovascular system, the respiratory system, and gastrointestinal system. Some participants reported eye and skin symptoms, but the most prevalent symptoms reported were neurological. Sensitivity of these individuals can be correlated with excessive or prolonged exposure to EMF or RF fields. Lab analysis frequently showed these individuals to have a high toxic body burden of chemicals or heavy metals, meaning that those with present high levels of toxins within their bodies showed higher sensitivity to EMF. So EMF sensitivity is a real disease. We all know our society is becoming increasingly dependent upon electronics. We're covering the earth with power sources, power transmission lines, and cell phone towers. And now we are forced to live with microwave pulsing smart meters attached to our homes. Everyone is hooked, addicted to their radiation-emitting cell phones. Schools mandate wireless classrooms. There's no escape. The powers that be plan on exposing us to the smart grid with Wi-Fi mesh networks, drones and satellites, and ever increasingly more powerful cell towers. And guess what? The powers that be don't care. It's money in the pocket right now. It's power. It's greed. It's sickening. Knowledge and understanding of EMF is becoming increasingly necessary for maintaining our health. You can be aware of excessive exposure to EMF by being educated regarding the nearness of high voltage power lines, substations, and cell phone towers. The correct choice of wiring and placement of wiring in your home is important. It's beneficial to the health of your home and you and your family to understand the impact of improper placement of grounding of electrical wiring, yet few electricians fully grasp the health impacts of faulty wiring. If electricity wiring touches or follows metal water pipes, stray electricity can develop. Stray electricity is an electric current which is strayed from its intended path into undesirable areas, sometimes creating elevated levels of EMF. Buried underground cables can become old and insulation can erode away. Objects can also penetrate underground cables, allowing electricity to find metal objects, sidewalks, you and your pets and children. Stray electricity can be a problem for homeowners and neighborhoods. We shouldn't be messing with this stuff, and we certainly shouldn't be happily accepting this health hazard into our homes, our lives. You can arrange your personal environment to avoid some of this, but in order to do so, you must be aware. And that's why I talk about this from time to time. How is this tied to patient safety, you might ask? Does this really qualify as a hospital hazard? Oh, you want to avoid a hospital visit at all costs, because just as a side note, a hospital is one of the worst places, one of the worst environments when it comes to EMFs. Between the electrical equipment, the fact that all hospitals are wireless, the use of computers and iPads and cell phones is ubiquitous, coupled with the fact that many hospitals house cell phone towers on top of their buildings, you don't want to land there. With all of that going on, a hospital is no longer a place to heal. So stay out of the hospital by paying attention to your environment. Make smart choices. Say no to anything that has the word smart on the label. No smart appliances, no smart TVs, no smartphones. These rely on wireless radio frequencies to operate. Microwave radiation. Don't bring these things into your homes. And practice safe phone. Reinstall that landline. Smartphones are nothing more than a high-powered cell tower in your pocket. And get rid of all cordless phones. DECT phones, DECT. DECT phones emit amazingly high levels of RF. My mom had one in her home. And one day I walked in with my meter that detects the levels. Oh my, it started squealing and screaming, the red lights flashed, and when I entered the room where she kept the base station, whew, wow, and we didn't know this. And how or why would we? No one warns us. Does the label on the phone box share any of this? And if it did, who can even read the tiny print in the multi-folded sheet in 36 languages? No, short of having a meter, you would never guess this until perhaps you started showing symptoms, and likely would pass those off as something else. You cannot get by anymore without owning a meter that detects EMF and RF. Because radio frequencies are invisible, you must own a detection meter to measure the levels of radiation emitted not only from your or your neighbor's smart meter, but also from cell towers in your neighborhood, stealth cell antennas hidden within flagpoles and church steeples, gas station signs, wireless in libraries, stores, coffee shops, hotels, hospitals, and from cell phones and second-hand phone. So we've partnered with a company called Safe Living Technologies to offer you the most effective yet reasonably priced meter to do the job. Now, of course, some sophisticated meters sell for thousands of dollars, but for you and me, the average person looking to detect the hazards in our everyday lives without going broke, we have a great handheld meter for only $144, and that can be found on our website, speakupandstayalive.com. speakupandstayalive.com. Just go to the tab on the top of the page that says Stop Smart Meters. And the handheld meter comes with some free gifts, my book, a CD, and no tax. So this is not about me selling meters. This is about sounding the siren of what is ramping up to be a wireless takedown. Let's get smart. Let's unite. Let's speak up and stay alive. And stay tuned. Our guest is going to introduce us to the Environmental Health Center in Dallas. It's one of the only clinics in the world to both recognize and treat electromagnetic field sensitivity. Now, let's hear some legal news you can use. Okay, it's a new year and you've made lots of resolutions. Me too. But now it's time to act on some of the big ones, the ones that have the potential to dictate your future. And I'm talking about your advance directives. You are living dangerously if you don't have an up-to-date healthcare power of attorney, a living will, or a financial power of attorney. If you want to control what happens to you, your health, your end-of-life wishes, and your money, get this done this week. And who better to help you with this than my friends at Schraff & King. This is what they do, and they even have a certified elder law attorney on staff, one of only a handful within the state of Ohio. So don't play roulette with your future. Call Schraff & King today and let them know that you heard about them on Speak Up and Stay Alive. Their phone number is 440-585-1600. That's 440-585-1600. Come on, make me proud. Call them this week to review your current documents or to update or create new ones. 440-585-1600 or visit them at schraffking.com. If you know me, you know that I'm concerned about healthcare-acquired infections. Stethoscopes have long been associated with the transmission of healthcare-related bacterial infections, and studies have shown that stethoscopes carry harmful bacteria such as staph. To eliminate the infection risk, doctors simply need to wipe their stethoscopes with a disinfectant swab after use on each patient. Despite this, a report in the American Journal of Infection Control makes it clear that providers do not heed the warnings, concluding that doctors must routinely disinfect their stethoscopes before and after each patient contact. There is, however, a viable alternative to the disinfectant cloth or wipe. Clean Stethoscope, offered through a company called Cleanant, is a device that enables doctors, nurses, or any healthcare practitioner to both protect and clean their stethoscope with the greatest of ease. By sliding the bell of the stethoscope into the Clean Stethoscope chamber, doctors can examine multiple patients without putting themselves or their patients at risk of healthcare-acquired infections. If you're a healthcare provider or if you're a patient, check out Cleanant.com. Cleanint, Cleanant.com. And patients or family members, tell your doctor about Cleanant and ask that their practice include the Clean Stethoscope from Cleanant. Call 888-715-0464. That's 888-715-0464. Are you listening to Speak Up and Stay Alive, Patient Safety Radio? And I am your hostess, Pat Rulo, always bringing you cutting-edge guests and topics that just love to go where mainstream stops. And today is no exception. If you listen to this program, you know that I step outside of the traditional box and talk about topics that cause harm to our health that ultimately may cause us to land in the hospital or within the healthcare spectrum. Issues such as the radio frequencies given off by smart meters, the proliferation of wireless devices that cause a host of symptoms and adverse health problems, cell phones, cell towers, wireless in schools, as well as topics such as the fluoridation of our drinking water, genetically modified foods, chemtrails. It should be clear by now that our environment affects our health, from pollen to dust, diesel fumes to mold to chemicals, heavy metal, medications, bacteria, and my hot topic, electromagnetic frequencies, microwave radiation. So when I came upon today's guest, I was impelled to invite him to join the show. It is with great pleasure that I introduce Dr. William Ray, the founder and director of the Environmental Health Center in Dallas, Texas, one of the only clinics in the world to both recognize and treat electromagnetic field sensitivity. They've also treated people from the Alaskan oil spills, Desert Storm, 9/11 victims, and those individuals who have become ill at home or work from exposure to carpets, paints, pesticides, solvents, formaldehydes, and many other chemical agents. A thoracic and cardiovascular surgeon with a passionate interest in the environmental aspects of health and disease, Dr. Ray has received numerous professional honors, including being named to the world's first professional chair of environmental medicine at the Roberts Institute of Technology at the University of Surrey in England in 1988. Named International Man of the Year in 1977, Dr. Ray has treated over 40,000 patients from all over the world who experience symptoms from environmentally induced causes. And for you Ohio folks, of which I am one, he was born in Jefferson, Ohio, and graduated from Otterbein College in Westerville, Ohio, and Ohio State University College of Medicine in Columbus, Ohio. So much more to know, but I'm looking forward to picking his brain. So welcome to the show, Dr. Ray.
Thank you very much.
Such a pleasure to have you here. We know that many common ailments may be traced to substances that we're exposed to in our everyday environment. What are the main environmental challenges to our health?
Well, the two most common that we find are the pesticides and the natural gas fumes. as you know from the Midwest, the corn and the wheat and all the different grains are sprayed with herbicides. According to statistics, that the state of Iowa has the highest cancer rate compared to the chemical dump areas in New Jersey, which are, of course, for New York City and everything. So those are equal now. So it's ubiquitous in the environment. And then, of course, there are also big city solvents, car exhaust, carbon monoxide, ozone, particulates, sulfur dioxides, city air pollutants for diesel trucks and cars. And then, of course, there's the electromagnetics, which is now a new epidemic in America because so many aerials are being built in all the different areas for the Wi-Fi.
Absolutely, and I want to go there today. There's just so many topics we can talk about, but that's what's been on our mind lately. So with your permission, I'd like to talk about that double-blind study that showed that certain individuals can be extremely sensitive to EMF. If you can share the outcomes of that.
Well, there's just absolutely no question about it. We study where we selected patients who were complaining of electrical sensitivity. You know, they complained of Wi-Fi, telephones, portable phones bothering them, and we put them in the room and actually de-adapted them so that they were symptom-free, and then we challenged them with placebo and with the different frequencies and found that we could trigger the electrical sensitivity and cause them to have illness. The other thing we found was that 80% of the patients also had a chemical problem, which was the electrical part was built on top of the chemical problem. So if you didn't address the chemical problem, it wouldn't get better.
That's interesting. So the one exacerbates the other, correct?
Yeah, it seems to be. Now, there are about 20% who seem to just have total electrical sensitivity and no chemical problems, but they're certainly in the minority.
And you found correlations between EMF and blood pressure, EMF and cataracts, and just so many other symptoms and problems.
Yes, heart irregularities. The EMF seems to give the autonomic nervous system, which is your automatic nervous system, which goes to your heart and your blood vessels and your intestines and also your brain. There seems to be what we call a sympathetic surge from that. That means an adrenaline surge. The block of that, the parasympathetic nervous system, seems to be decreased in about 60 to 80% of the patients.
And there's been to date about 8,000 military studies done from way back when that prove this, and yet it's being covered up, and people are still wondering what their symptoms are all about and being misdiagnosed and mistreated. I want to talk about cell towers near schools and how that's causing cancer to rise, and the wireless devices in schools that are causing children's IQ to drop. I know you have something to say about that.
Yes, as Dr. Milhelm out in California has done some beautiful studies, in which he showed that if a tower was near a school, the teachers had a 20% increase in cancer each year, and the kids' IQs dropped 5 points each year. Well, I mean, that's staggering when you think about that. Is there any reason why our kids should be dumb? Well, we don't want that. We want them to improve their IQ, don't we? And improve their ability to remember and ability to create. I see them all over Dallas, which are in that area now, and that's only occurred in the last couple of years.
Right. We're going to be interviewing Dr. Sam Milhelm next week, and
good.
Yeah, I look forward to that conversation with him. I mean, the cell towers are ubiquitous; they are everywhere, and now that's mandatory with the Wi-Fi in the school. And you talk about dumbing down our children. Well, if these studies are showing that, why aren't people paying attention?
That's the big thing for me. You know, for some reason, the effects of the environment have been covered up in the press and in the education systems of America, particularly the universities, for the last 30 to 40 years, because we've worked on these studies, both the chemical and electromagnetic, for about 35 years, 40 years, and there's no question that it influences the body. And the other thing, I'm a heart surgeon, and I've shocked hundreds of people back to life. Because you need to have an electrical impulse for them to work properly, right?
Right.
Well, that's been known for 50 years. And so we know that electricity affects the body. And we also know that from the bypasses in the heart lung machine, and if you get too much oxygen, which acts like ozone, you'll get what's called a respiratory burst, and the patient can go into shock from that. Mm-hmm. So, I mean, it's not like that there was new information. There was great information which has been sort of somehow suppressed, and then all this new information is built upon it, you know.
Right.
So I don't know why that is, but it's an enigma to me, because supposedly academic institutions which do the teaching are supposed to look on the new ideas and get them. But, I mean, some of these are old ideas with tons of documentation, and what I keep hearing all the time is there's no documentation. Well, that's just pure baloney.
Right. Right. That's what I said. There's over 8,000 studies already done. So when people clamor for more research, that's a stall tactic. There's no need for more research. It's out there. And everyone wants to treat the symptom and not the cause. And even in schools, they're installing defibrillators because kids are, having heart palpitations and heart problems.
Which is, of course, ridiculous, because we do know what causes it.
Right.
See, that's the problem. And why have we had to have that now when we never had to have it before? I mean, kids didn't have any cardiac arrest, I mean, it's ridiculous.
Yeah, it's pretty darn scary, actually, and we need to do something about it fairly quickly. I want to talk about your clinic, because what you do there is, as far as EMF and actually all toxicities, that the symptoms can be reduced by controlling the environment. What person or who should seek your consult and seek your services?
Well, I think anybody who doesn't have a solution to their problem immediately. Mm-hmm. Our average patient has gone through the Cleveland Clinic, the Mayo Clinic, 20 doctors, and had no help. Well, that's waiting too long, and it should be people who can't, if they find a doctor and the doctor doesn't want to look at the cause, then they need to come here, because we look for causes.
Right, and it could be any host of symptoms that are just simply going undiagnosed too long, correct?
Yes, that's right. I mean, look, chronic fatigue and weakness, that's one of the main first symptoms of pollutant injury, okay? So how many people that have this chronic fatigue and weakness have been looked into the cause? And, of course, if it's not a bacteria or viral, people just ignore it. Mm-hmm. And that doesn't solve the patient's problem at all.
Right, just throw some drugs at it, right?
Yes, and of course, what happens is they suddenly will start getting refractory to drugs, and they can't tolerate any medication.
Right.
And then everybody throws their hands up and says, well, we don't know what to do, Well, that's where your controlled environment comes in and where you can decrease the load. See, all our environment, both the living quarters and the clinic, is 5 times less polluted by chemical analysis and particulate analysis. And so we know that it's much less polluted than the average area,
Yeah, I saw that you offer a less toxic housing option where the patient's isolated from outside environmental factors, and that the units have been designed to eliminate exposure to any offending substances.
That's right.
Yeah.
As much as you can in a city, And this really makes a big difference, because a lot of people will then start clearing up, and pretty soon they'll get into their area where they disadapt and they don't get used to something anymore, and they can prove cause and effect. And a lot of it is we don't have to tell them. Well, look, they'll tell me, hey, boy, when I cleared up, this bothers me. A perfume will bother me now, or pesticides will bother me, or et cetera. And they can give you, well, it decreases my migraine headaches because it caused the migraines, or it caused my heart irregularities, or it caused my bloating and food sensitivity, you see, or whatever it is.
Yeah, you mentioned an adaptive phenomenon where you just kind of get used to the problem and consider it, oh, well, I must be stressed or something else, and not really looking to find out. Yeah,
I think that's the other thing, is you got to realize that a lot of this is pinned to stress without any scientific data, whereas with the environmental things, you can prove cause and effect, which is a lot better to do, you see. Mm-hmm. And, everybody gets a little bit stressed sometimes, but that's not the issue. The issue is what is going on in the brain and what is going on in the communication systems of the body that to trigger that, you see. We see this all the time. Well, we can't find anything wrong with you, so go see a psychiatrist.
Right. And how many folks has that happened to? I know just one of the co-hosts of my radio show, he has an extreme sensitivity to EMFs, and his record says that he's delusional. Well,
yes.
That's not solving any problem.
Without any proof, right?
Exactly. Just because they don't want to admit or look into or figure out what's wrong, well, the patient must be nuts.
Right.
Yeah.
Yeah, we see that frequently.
I'm sure you do, and I'm sure your doorstep is probably a last resort for so many people when it really should be the first.
Well, you're exactly right. Unfortunately, it's true. And I draw patients from all over the world, and the same thing happens every place. Mm-hmm. That they've been through all the docs, and some of them get so they can't eat any food. They're super sensitive to food. Yeah. They lose weight. They really have severe fatigue and weakness because of that, and their nutrition gets screwed up because of that. It's too much demand on the detoxification systems, and therefore it's overutilized, you see, mm-hmm. and therefore you get nutritional deficiency.
Right, and once that happens, you can't heal at all. Explain the process then. Should a person decide to come to your clinic, how does that work?
Well, of course, what we do is usually place them in a controlled environment for a period of time, and as soon as we can start testing them after a good history and physical, we have to do that first, you see. Then we will go ahead and try to prove cause and effect. If they're real food sensitive, of course, we'll give injections for the right doses of foods until they can tolerate foods. If they're mold sensitive, we give them injections for the molds. And if they're chemically sensitive, we may give them some injections for them. And we may give intravenous nutrients, and we give oral nutrients like vitamin C, glutathione, multiminerals, multivitamins, and so on, so that they can start getting their energy back and get a program where they can weave through society with cause and effect, because they now are clear enough that they know, hey, this area bothers me, this area doesn't bother me, this thing bothers me, this area doesn't bother me. And they can use their own body's own receptors for this, you see, which is, of course, I think that's how we were designed.
Now, do folks stay in these housing units for a period of time, or can somebody just come in and be evaluated and go home with your guidance as to how can they clean their environment at home?
There are three groups, of course. The first group never comes into the living environment because they live at home, you see. Mm-hmm. And those are local or semi-local people within a couple of 100 miles. Then there's another group who has to live in the controlled environment for a period of time, usually a week or two, although we've got some people that are there for 6 months to a year, because they're so wounded. So it's a whole spectrum. Most people just come in because they're feeling bad and feeling fatigued and they can't tolerate medication, and we work them out from home. And, of course, one of the problems, as we said, is pesticides and natural gas. And of course, it's harder to work those people out at home if they've got natural gas or if they have pesticide in their house. The other big problem is the houses. So many of them are getting moldy now that people have to move out of the moldy house, A
lot of causes here. Now, you talked about the controlled environment. So even down to the water in the showers is filtered, and the furniture, the floors, the ceiling, everything is as clean as possible. How can someone possibly recreate that at home?
Oh, we've had thousands of people do that now. They can get water filters, There are certain ones that are really designed very well for that. They can eat organic food. Mm-hmm. We like on the drinking water either good glass bottled spring water or some double filtered water or distilled water, you see. And so they can do that at home. And you eat organic food, and you got to have a variation of a diet. You don't eat the same thing every day. You have what we call a rotary diet, where you eat the same thing only once in 4 days, you see. Mm-hmm. And then a lot of people have to take up their carpets or a lot of pressboard plywood cabinets. They have to go ahead and foil those with aluminum foil to keep the formaldehyde from coming into the air, and so on.
Well, now, in your controlled environment area there in Dallas, now, are there cell towers located nearby?
Unfortunately, they are. They didn't used to be. They just put them up in the last year.
Yeah. Now, how do you fight that within your facility?
Well, see, my real clean side we designed about 30 years ago. Is sand fused on steel at 2,000 degrees. So it's a porcelain metal shielded, and all our window blinds are made out of aluminum, and therefore that will shield it.
Excellent.
And of course, we made one gross mistake when we built this. We put in fluorescent lights, which were changing it incandescent, and we also are in the process of putting in some of the Stetzer filters and some of the other filters that to get rid of dirty electricity. But it's like I said before, it's totally clean, about 5 times less polluted for chemical and particulate.
Now, sticking with the EMF topic for a moment, so when folks come to your clinic, I'm sure they're bringing their cell phones with them. Do you allow that in the controlled environment or even in your office?
No.
Okay.
We do not. And we have no computers on the side, our most sophisticated side.
Well, I mean, it's easy to hardwire things, right?
Well, yes, and that's the alternative for all these towers. Is I think Chattanooga, Tennessee, is elected to use fiber optic cables and not use cell towers. Well, why don't other people do that?
You mentioned that to me before, and I looked that up, and that's huge. I mean, they've got companies moving from Knoxville and all over to Chattanooga not because of the health aspect of it, obviously, but because they're thinking, wow, the fiber optic delivers the internet faster, and so businesses are moving there. Not only is it faster, it's cleaner. It might be a little more expensive in the beginning, but wow, for speed and ultimately for health, why isn't everyone looking into that?
Well, that's my question.
Yeah.
I wonder that, and I think you should, your listeners should take that into consideration and see if they can't push for that.
Exactly, on a local level. Now we're talking about cell phones. What do you think about secondhand phone? You can't even go anywhere maybe you don't own a cell phone or use one, but you're standing in line anywhere, and now you're getting bombarded by somebody else's.
Well, that's true, and a lot of people will complain about it to me that they get sick from somebody else's,
And then there's dental implants and metal prosthesis and body implants. Let's just talk briefly about that.
Well, that's one subject we haven't covered yet, you see. But there are something like 220 different implants now. And so people with teeth like Mercury amalgams, or even the acrylics, the composite ones, can have trouble with it. Last week I've seen 3 people who've had tooth implants, and of course they're titanium on the enamel, and they're sensitive to it. We see people with jaw implants of silicone who have problems, breast implants, fractures. A lot of the orthopedic procedures, they act like antennas, and these are steel and titanium titanium alloys, which has a lot of nickel in it. And then there are the other type that are used for internal areas like the intestines and the hernias, the polyurethanes and polyvinyls, and these people can increase their total body pollutant load and have problems with those. Now, a lot of those we can neutralize with our injection therapy, and that works very well. But some of them you can't, and some things can be removed, some can't. For example, I had a lady who had a pacemaker put in, and she reacted to the metal in the pacemaker, and she was worse off than beforehand. We were able to neutralize her, and she did well for 2 years, and then the pacemaker failed. They put in a new one, the same thing happened, but we did lucky enough we were able to neutralize all the metal and all the stuff that was in it, and she's been 5 years more, so she's got total 7 years of neutralization, and of course decreasing her environmental load also. So there you are with that. You've got to think about antenna effects of metals in humans.
And that's important for folks to think about the antenna effect. But then, as you mentioned, you try to, say, get rid of the mercury dental fillings. That has to be done with extreme care because that mercury is extremely toxic. And I know that even the dentists and their hygienists are wearing hazmat suits, basically, if they're doing it properly, because of the toxicity of that. So if someone's looking to get those fillings removed, they need to make sure they're going to a certified dentist that knows how to properly remove them.
I agree with you. And the other thing is they need to be tested on what they're going to put in because they can get out of the frying pan into the fire. Some of these I've seen, So I've seen them put in composites, and they had those are acrylics usually, and they had problems with that, or silicone. And so, they're usually gold or porcelain are the two best.
Okay.
And that seems to be the safest that we can tell.
All right, that's good to know, gold or porcelain. And then as you're talking about metal in the body, then think of the chemtrailing that's going on with all of the aluminum and barium and selenium that they're dropping from the skies on us that are affecting us, our food supply. So,
yes.
We may not...
Why are they doing that?
Why are they doing that?
Yeah.
That's an interesting... that could be another show, right?
Yes.
Oh my gosh. Well, I know there's so much more we can talk about today, and I know you're short on time because you've got patients to see. Well, do you have any final words of advice for our listeners today?
Well, I'd say be aware of your environment. It's not all genetics. As a matter of fact, genetics are just the mechanisms that allow somebody to react, and nothing occurs by magic. You've got to have an environment to trigger it. And look for the things in the environment and listen to yourself.
Right. So if folks are listening to this and they're thinking, whoa, the light bulb goes off and they're thinking, I need to look into this, where can folks find more about you and what you do, and how can they contact you?
Well, I think we're on the internet at ehcd.com, and then our phone number is 214-368-4132. And Sue is our intake gal. She can help information, and so can the nonprofit foundation, the American Environmental Health Foundation.
Okay.
They have a lot of goods and services to help these people.
All right. So, folks, the Environmental Health Center Dallas looks beyond the ordinary to find reasons for illness. They investigate all the possibilities which can affect a symptom response, from heredity to home and work environment, from allergen to toxicity, and from immune parameters to nutritional deficiencies. Assessments will be made according to you, your lifestyle, and your unique environment. And I encourage anyone who suffers from symptoms with no solutions to visit the website ehcd.com. ehcd.com. It stands for Environmental Health Center Dallas, or as Dr. Ray mentioned, you can call 214-368-4132. 214-368-4132. And I'll have this interview on our website, so just go to speakupandstayalive.com. Dr. Ray, what a pleasure to spend time with you, and I know we only touched the very basics of a few problems that you addressed. So
anytime.
Yeah, feel free to come back anytime.
All right, go Buckeyes.
You got it. Thank you. Is your home stressing you out? Are your appliances and gadgets damaging your health? Are you concerned that modern technology could be ruining your and your family's health? Scientific evidence suggests that everyday chronic low-intensity magnetic field exposure poses a possible health risk. Therefore, the conclusion is that magnetic fields remain classified as possibly carcinogenic, meaning they can cause cancer. And what about the radiation levels from wireless computers, routers, cordless phones, baby monitors? I know I've experienced disrupted sleep, grinding teeth, headaches, and waking up tired and didn't know why. Others I know experience hyperactivity, concentration and memory problems, muscle and joint pains, cardiac palpitations, fatigue, irritability, and erratic high blood pressure. And after multiple visits to doctors, still could not get an accurate diagnosis. Finally, I asked myself, could all of these symptoms be caused by invisible hazards? There is a growing body of research that shows that today's ubiquitous technology can be damaging to our health. So I had someone come to my home with highly sensitive measuring devices to measure the levels of electric frequencies, magnetic frequencies, radiation frequencies, and dirty electricity within my home. Oh my, was I ever shocked! Things like cell phones, routers, chargers, power strips, smart meters, dimmer switches, and on filled my supposed sanctuary with invisible yet damaging health hazards. Once I removed these hazards from my home, I slowly began to feel better. So I'm suggesting that you too have a healthy home consultation to identify problem areas in your home. The folks at Healthy Home will test the EMF levels in your home using small, specialized equipment, focusing particularly on areas of the home where you spend most time. And then we'll make recommendations about how you can reduce your exposure and minimize the effects on your health. The home consultation includes full measurements of electromagnetic fields within every room in your home. It takes about an hour, and you will be given a comprehensive report that includes full recommendations on how to reduce the negative impacts of EMFs and turn your home into a healthy, healing, and safe environment. And for a limited time, I'll even come out with them to meet you and help explain the findings. Call me, and I'll pass on the information. 440-725-5462. Don't feel like this. When you can feel like this. Schedule a healthy home consultation today, and I'll come too to meet you and share what I know about healthy homes. Call 440-725-5462. That's 440-725-5462. And remember, a healthy home is a happy home.
Tired of the same old presentations?
Can you forward to slide 38, please?
Are you looking for a new, out-of-the-box topic for your next event?
Want your group to leave inspired, informed, and satisfied?
No PowerPoint presentations and dim lights here. No snoring or snoozing goes on during Pat's presentations. To help your entire group, organization, business, or church stay safe during any healthcare or hospital experience, invite Pat to speak. Pick a topic from her website or request your own. Visit her website, speakupandstayalive.com, or call Pat to discuss how she can make your next event fun, enlightening, and life-saving.
Want testimonials?
Go to the bulletin board link at the website for color pictures and comments from real people. Again, it's speakupandstayalive.com or call 440-725-5462. That's 440-725-5462.
You're listening to Speak Up and Stay Alive, Patient Safety Radio, and I am your hostess, Pat Rulo. And today, we spent most of our time together talking about the health dangers associated with EMF, electromagnetic frequencies, and RF, radio frequencies, frequencies in the microwave range that are emitted from everyone's favorite appendage, the cell phone, as well as the looming monster every mile or so, the cell tower, to the smart meter that you didn't consent to having slapped on your home, to Wi-Fi in schools, offices, churches, libraries, and yes, hospitals. And I want to know what you think about all of this. So I mentioned at the beginning of today's program that we are changing the format a bit, still keeping the healthcare hazard of the week, shortening the guest segment, but most importantly, we want to hear from you and add your voice to the show. With that, each week, I'll be asking for your input on a topic. So here's how we're going to do this. Each week after the show, call or email us and let us know that you'd like to be on the air with your thoughts. When you call or email, be sure to tell us who you are and leave a callback number. Now, you don't have to tell us your thoughts right then. This is simply a time for you to let us know that you have something to say. Do this before 2 o'clock Eastern Time every Saturday, and we will make return calls each Saturday between 2 and 3 Eastern Time. Now, sometime during that hour, I will call you, and we'll pre-record a short conversation between you and me, with you sharing your thoughts about our topic. Now, don't worry about being perfect, as we can edit out any weirdness prior to airing the next week. And if you don't want us to use your real name on the air, that's cool with us too. Now, if you can't call on Saturday, call or email whenever you can, but we will only make callbacks on Saturdays from 2 to 3 p.m. Eastern. This is the time we'll be in the studio to record. And this will be done on a first-come, first-served basis. So if we get 100 calls, we may not be able to call you back on Saturday between 2 and 3. The email address is, grab a pen and paper. The email address is pat@speakupandstayalive.com. pat@speakupandstayalive.com. The word "and" is all spelled out. pat@speakupandstayalive.com. And the phone number is 440 440-725-5462. 440-725-5462. So this week, I'd like to know what your thoughts are on the health dangers associated with cell phones, cell towers, wireless gadgets, and so on. Are you practicing safe phone? Are you concerned about your health or the health of your loved ones when it comes to this constant exposure of radiation? Have you felt any effects or any symptoms? I already hear from so many of you after the show, so now maybe we can get you on the air, as you always have spot-on ideas and comments, and I'd like for you to be a part of the show. So the email address is pat@speakupandstayalive.com, and the phone number is 440-725-5462. Just let me know that you are interested to be on the air. We will try to call back between 2 and 3 on Saturday. Well, that's it for today. Be sure to listen to our internet radio station, speakuptalkradio.com. Speakuptalkradio.com. I've attracted some awesome shows that I know you'll love. Entrepreneurs on Fire. This show received 7.9 million downloads on iTunes. Another show, Helping Writers Become Authors. It's another new show. Here's one, Love Life. Or is it Love Life? From a hosting duo out of Australia, and so many more. So tune in to speakuptalkradio.com and come back next week. Same time, same place, but never the same information. But do remember, this is our last airtime on WHK at 7 o'clock in the morning in Cleveland, Ohio. But you could still find us in Cleveland at our usual 9 o'clock time on sister station WHKW. That's 1220 on your AM dial. Well, I hope you have a healthy and a happy week, free from dirty electricity and microwave radiation. I am Pat Rulo, and I am your guide to safe and successful healthcare and hospital encounters.
Listen to Pat Rulo and Speak Up and Stay Alive Radio. Stay safe from little-known healthcare and hospital hazards. To learn more, go to speakupandstayalive.com. That's speakupandstayalive.com.